with the Scottish Government. What about the mental health and the education of school kids? So joining me in the studio now is life coach, hypnotherapist, Lucia Mizzoni. Good morning, Lucia. Thank you very much for joining us. Now, when we talk about these strikes, we had an interesting, heartbreaking interview with a woman the other day whose husband died because her ambulance didn't turn up. And when I think we really can understand these strikes is when we think about the human consequences of them. And so it's not really about whether the strike is right or the strike is wrong. But what I'm interested in is the effects it might have on children who've already been through so much. What are your thoughts on that?
It's indisputable that the absence from school during the pandemic, there is lots of research that's been done by Gov.uk and Mind and different organizations that proves how the impact was detrimental, mentally, emotionally, from a learning point of view. And there are reasons for that. 90% of the children and the students interviewed stated themselves that they felt their mental health was seriously damaged, and the manifestation of that damage goes and manifests through anxiety, depression, suicidal tendencies, thoughts. I see it in my own practice. So that's undisputable. The numbers are there. And for that very reason, to imagine a scenario in which children are not allowed to access face-to-face, one-to-one interaction with their teachers and be surrounded by their peers is certainly very welcomed. Psychologically, that is explained. There's something called the human needs psychology that lists 6 fundamental human needs, and I can list them for you. And when I look at that, I see that 5 of those core needs have been greatly affected and unmet during the pandemic or any time that a child cannot access an institution like
also
school.
Like if they've got strike days and they're having to be at home. So give us an idea. What are those?
Those needs are, first of all, the needs of certainty. Any human to thrive and become a functioning adult, a well-rounded adult, needs certainty. Certainty means predictability about the environment one is living in, predictability about the future, routine. Children and students need routine to thrive. Certainty is removed when the access to school is not offered to them. And how does lack of certainty then manifest in terms of psychological byproduct is either compulsive behavior, so the need to control, and OCD, eating disorders, or complete helplessness, apathy, and depression. And I see that in my practice, and all the research proves that. So that's one of the first unmet needs. Then there is also the need of uncertainty, excitement, so the stimuli of your environment, accessing your peers, adventure, that's also another core fundamental need. The third need, specifically important for that age group, pre-adolescents and adolescents, is the need to be validated by your peer group. So the importance of being able to interact with your friends. That's, the family becomes secondary and it's replaced by the peer groups that was taken away from them. And the consequence of that is a sense of isolation and disconnect, and therefore depression. And then you have the need to be connected. There's a real need to belong to the tribe. This is very primitive need. That's how we're wired. Your tribe becomes your outlet to protect yourself. And then these are called personality needs. And then there is more spiritual needs. One is the need to grow, which is obviously affected because there is no growth isolated at home, and the other is the need to contribute, the 6th need. And I think that's the one that hasn't been affected because I think the pandemic allowed everybody to reach out and feel connected to the rest of the world.
So if these children who've been through so much, this particular demographic, and I know you have 2 teenagers yourself, if we're now going to be telling them that the certainty of going to school is going again, what might parents see? What can we look out for in the behaviours of our children, and what can we do to help them?
We can see, and we will see if that happens for a prolonged period of time, different dysfunctional behaviours that could manifest through anxiety, so an increased need to control, fear, helplessness, depression, so a sense of isolation and disconnect. And there has been a significant increase in children lamenting these issues. I see it personally in my own practice, but obviously the numbers tell us. So look out for discomfort, distress, and anxiety, or maybe a child becoming more withdrawn and isolated, eating patterns changing, maybe use of technology. I know you're going to cover that later. Increase in the use of technology, so monitor how much access you give. It's a very complex and worrying issue.
Here's the thing. There will be some children, I think mine will probably be amongst them, who might go, oh, I really love a day off. oh, mummy, I can't think of anything better than sitting in my bedroom and playing on my screen all day. Is that also valid?
But that's to be expected. It's kind of age appropriate.
Yeah.
You know, my
Quite
children.
jealous, personally.
Yeah, exactly. And my children themselves didn't really get affected much during the pandemic because they had the luck maybe to have a healthy home environment. But that wasn't the case for many others, and more the underprivileged also groups. There was an enhancement of issues that were already present in the home. Yeah, one day it's very healthy to reset and reboot. We all need that. So that can be a nice break, a removal from the pressure and the routine, but one day, not, you know, a subsequent sets of days back to back for several weeks.
Yeah, and like you say, it comes down to that word uncertainty again. That's what I felt during the lockdowns, but also that is what the children are going to see with these teacher strikes. Am I going to go to school next week, Mum? When is the next strike? When is it going to come along? Will we be having strikes running up to the Easter holidays? I know this is a bit more of a political question in a way, but as a psychologist, does it disappoint you that all of this evidence is there now of how disrupted children are, and yet the teachers are doing this on the back of such an extraordinary period of time?
You know, Bev, I believe and I see in the resilience of the human mind, and, you know, we cannot change what has happened. We can never do that. But what the pandemic and potentially this new coming up disruption can offer is an opportunity for also children to go inwards and understand what is it that I can do in this situation, what meanings can I create out of this situation. Maybe I need to become more self-reliant and not constantly seek validation externally in the peer group. It's definitely an opportunity to reflect on what one can do more of, or the areas that have been brought to the surface, how can they be rectified. And in the case of children, obviously they depend on adults helping and facilitating that process for them.
I know this isn't exactly what I brought you here to talk about, because I know that this interest is about the psychology. Oh, we've got to move on. I think we're going to go and listen to Rishi Sunak. But thank you.
You're welcome.
Mizzoni.